treatment for reflux disease, the least invasive thing you can do is diet and exercise. So if you're overweight, you should lose weight. You should avoid foods high in fat, greasy foods. You should avoid large meals because if you fill up your stomach, it's more likely to be regurgitated and cause injury. You should avoid wearing tight-fitting clothing. Avoid eating big meals and then lying down. So we recommend for our patients that they should eat an early dinner and then wait at least 3 hours till they lie down and keep gravity on their side. And then it brings us to the antacids, which would sort of be the next step up. Those types of medications can help neutralize acid and prevent injury. And if that's not enough, then it's the acid suppressive therapy, which is the H2 blockers. And really the cornerstone of reflux treatment for the last quarter century almost has been proton pump inhibitors. They're one of the most commonly prescribed medications in the world, but there's some recent evidence to suggest that they're not as safe as we once thought they were. And it can potentially lead to small but perhaps significant increased risk of cardiovascular disease, bone loss and hip fracture. So we're now no longer so quick to recommend that patients can stay on these medications for life. If the medications are working and patients don't want to take the risk of being on them, well, there's some other more invasive options. There's an endoscopic technique that we offer here at UC Davis, and that's called Stretta, which is when we put a radiofrequency catheter into the esophagus and deliver some energy endoscopically to the valve of the lower esophagus. And over the ensuing months, the energy causes the muscle to remodel, which actually tightens the lower valve of the esophagus and helps prevent regurgitation. You really should seek specialty care at that point if you're contemplating surgery. This is not something we would recommend that patients just go to their family doctor to seek surgical advice on.